Question 48. Teeth. Each tooth consists of a crown, a neck, and a root, and is made up of dentine, the crown is covered by enamel, and cementum covers the neck and root. That's the brown. That's cementum. A tooth contains a pulp cavity, which is inside here, which is this one, which is divided into a pulp chamber and a root canal, or pulp canal. The pulp canal opens on the tip of the root as the apical foramen, where the nerves and vessels enter and exit the tooth. The dental cavity contains dental pulp, which is composed of fibrous tissue, blood and lymph vessels, and nerves. See, the yellow one is a nerve, and then you have an artery and a vein, and there's also lymphatic vessels and fibrous tissue. The root of the tooth is connected to the wall of alveolus in the maxillary or mandible bone by a periodontal ligament, which is this one. Periodontal ligament. That's the attachment for the tooth. And we have gingiva or gum, which is a mucous membrane covering the neck of the tooth and the bone. Now the crown of the tooth has 5 surfaces. You have labial or buccal surface, which is directed towards the vestibule, so it's the outside. You have palatal or lingual, which is directed towards the oral cavity proper. You have mesial or anterior, which is directed forward or towards the preceding tooth. So, and distal, this is the distal surface, and this will be the anterior surface. And you have the 5th surface, that is the biting or occlusal, which is directed towards opposite tooth, so on top of the tooth here. We have 4 kinds of teeth. We have incisors, canines, we have premolars, and we have molars. The incisor is central and lateral, so we have 4 incisors as an adult. And the crown has a biting surface that is simply an incisal edge. So it's made to cut off when you're eating. And the root, as you can see, is simple. Only one. The canine tooth has a single cusp instead of an incisal edge. And the root is the longest, elevating maxilla as canine eminence, right here. So elevating the bone. The premolars has a bicuspid crown with the buccal and lingual cusps, and the root of the upper first premolar usually has 2 roots, not drawn on this one, and the other ones have 1. Now the molars are the largest teeth, and the largest is the first one. You have first, second, and third. The third is the smallest of these 3. and the crown has a large occlusal surface or biting surface with 4 or 5 cusps separated by fissures. So this is fissures. The upper first and second premolar has 3 roots, and the other ones have 2. The teeth are arranged in 2 dental arches, one upper and one lower dental arch. And we have 2 sets of teeth during a lifetime. We have child teeth that are called deciduous teeth, and we have permanent teeth that we get as an adult or as we get older as a child. First you have 20 deciduous teeth. You have the teeth are divided into quadrants. This is a quadrant, so you have 4 quadrants. In each quadrant you have, of deciduous teeth, you have 2 incisors. See, here is a picture of a child with deciduous teeth and permanent teeth lying underneath. So it has 2 incisors, 1 canine and 2 molars. And as an adult you have 2 incisors, 1 canine, 2 premolars and 3 molars. Now the eruption of these teeth. The central incisors comes first, and you get those teeth erupt by 6 to 8 months old. So this is the dental arches of a small of the deciduous teeth or milk teeth. The lateral incisor comes at 8th to 10th month. The canine comes at 15 to 20 month. The first molar comes at 10 to 16th month, and the second molar comes at 20 to 30 months old. And now the permanent teeth. The central incisor shows up at around 6th to 7th year of age. The lateral incisor, the 8th or 9 years of age. Canine at 9 to 14 years of age. First premolar, 9 to 11 years. Second premolar, 11 to 14 year. The first molar, 6th to 8th year of age. Second molar, 10 to 15 years. And the third molar, 17 to 30 years. That is also called the wisdom tooth. That is very painful to get for some people. Now the blood supply and nerve supply of teeth are maxillary artery and vein and trigeminal nerve.